Okay, let's talk about glioblastoma. We know it's one of the toughest cancers out there to treat. But what if the key to better outcomes isn't some single magic bullet breakthrough? What if it's about a whole new way of thinking about treatment? That's what we're diving into today. Some really fascinating research on how complementary care might just give standard treatments a major boost. So here's the big question we're tackling, and it's a huge one. Could things like nutrition and supplements actually support brain cancer treatment? I mean, could they be that missing piece of the puzzle we've been looking for? Well, researchers are digging into this exact idea, and you're going to want to hear what they're starting to find. All right, before we go any further, I have to stop and make something crystal clear. This is super important. What we're talking about today is a summary of research. It is not medical advice. I repeat, this is not a prescription. The whole point here is to give you information, to arm you with knowledge, so you can have a better, more informed chat with your oncologist. They're the expert on your case, and they are the only person who should be guiding your treatment, okay? Okay. So with that really important disclaimer out of the way, let's get into the challenge of glioblastoma. Because to really get why this new research is so exciting, you first have to understand the reality of a GBM diagnosis. Yeah, there's no sugarcoating it. A glioblastoma diagnosis, GBM, it completely changes your world. It's an incredibly tough journey for patients and for their loved ones. But it's often when we're faced with the biggest challenges that science really kicks into high gear, searching for those new frontiers, those new ways to help. And that's exactly where we are right now. We're looking at a brand new frontier in research, and it's all built around one key idea: supporting standard care, not replacing it. So let's be really, really clear about what this means. This is not about conventional versus alternative, not at all. Think of the standard treatments, surgery, radiation, chemotherapy, as the absolute foundation. They're the essential, non-negotiable bedrock. What we're talking about here is adding another layer on top of that foundation, an extra layer of support from nutrition and supplements that could, potentially, make that foundation even stronger. And, this quote from the source material just nails it. It says, natural compounds can radically improve the results of oncology treatments by helping the drug's effectiveness. The idea is so simple, right? But it's also incredibly powerful. What if we could just give the mean treatments a little boost? Okay, let's get into the specifics now. First up, we're putting the spotlight on a compound that comes from a pretty surprising source: green coffee extract. So the hero of this first bit of research is a compound called chlorogenic acid, or CGA for short. Now, here's the cool part. Researchers think it might work by kind of hacking the tumor's own little environment. Imagine the tumor has its own defenses up. CGA might be able to get in there and tell the body's immune system, hey, wake up, go after this thing. So let's look at what happened when they tried an injectable version of this in a small study alongside standard treatment. Okay, let's talk numbers, because this is where it gets really compelling. In this small pilot study, check this out, 10 out of the 23 patients survived for more than 20 months. Now, just to put that into perspective for you, the typical median survival for GBM is around 15 months. So yeah, when these numbers came out, the research community definitely sat up and paid attention. And it doesn't stop there. Out of that same group, 6 patients, that's more than a quarter of them, lived past the 30-month mark. Again, you just don't typically see numbers like that for a GBM diagnosis, especially from a small, early trial. But this is the number that just stops you in your tracks. 2. 2 patients in this study were actually reported to be in remission when the research was published. Now look, we have to be careful. It's a small study, it's early days, and this all needs to be tested in much bigger trials. But wow, what a powerful sign that this could be a really, really promising path to explore. All right, let's switch gears completely now and look at another pilot study that took a totally different angle. This one is all about something called functional foods, and we're talking about things that might be in your pantry right now. So this research centers on a protein called anti-secretory factor, or ASF. And get this, you can actually get your body to produce more of it by eating certain kinds of specially processed oat and egg foods. The working theory is pretty fascinating. Tumors can build up this intense internal fluid pressure. Think of it like a balloon being pumped way too full of air. And that pressure helps them grow and resist treatment. Well, ASF might work by helping to essentially let some of the air out of that balloon, making the tumor weaker and more vulnerable. So, what happened in the trial? Well, the results from this small study out of Sweden were frankly remarkable. Just look at the chart. The group that ate this special food alongside their treatment had a median survival of 23 months. Compare that to the control group at 14.8 months. That's a 55% increase. That is a huge jump. And just like we saw in the other study, there was an incredible individual story here too. One patient who completed the treatment was reported to be completely disease-free at the end of the trial. Okay, so what does this all mean? What do you do with this information? The research is obviously really exciting, but the real power, the real takeaway here is how you can use it. It's about moving from just hearing information to actually starting a conversation. And this quote right here, this is the mission. The whole point of this explainer isn't to hand you a checklist. It's to enable active engagement with your oncologist. It's about making you an empowered, active partner in your own healthcare journey. So what does that path forward look like? You can really boil it down to 3 simple steps. First, just recognize the promise here, the hope in this emerging science. Second, and this is the most important one, I'm going to say it again, understand that this stuff supports, it doesn't replace standard care. And finally, number 3, partner with your doctor. Take this information to them and just talk about the science. And that really brings us to the end. Look, we've been talking about small early studies. There's a lot more work to be done, for sure. But what they represent is so much more than just numbers. They represent hope. They represent new possibilities. And maybe most importantly, they give us new questions to ask and new conversations to have. So I'll leave you with this final thought. What conversation will you start?